Hi, I'm Dr. Phillip Massengill. I'm with ENT Allergy Associates in Middletown, New York. I'm here today to discuss a little bit about sinus surgery, and more specifically, navigational endoscopic sinus surgery. The most common question I get asked from my sinus patients is, what is the difference between sinusitis and allergies? And the quick answer is, there's not a lot of difference except the color of the secretions coming out of your nose. Meaning allergy symptoms can give you exactly the same symptoms, headache, facial pressure, runny nose, postnasal drip, as a sinus infection. The difference between the sinus infection is that somehow the sinuses are not functioning properly or they're blocked. I have a diagram here which demonstrates the sinuses. You have 4 paired sinuses and they're named from the bones in which they sit. So these 2 sinuses in the cheek, which give a lot of people trouble, are called the maxillary sinuses because they sit in the maxillary bone. Similarly, you have 2 sinuses in between the eyes. They're called the ethmoid sinuses. They sit in the ethmoid bone. The frontal sinuses are up in the forehead, in the frontal bone. And then if you look at the very side, in the very back of the nose, there's a sinus called the sphenoid sinus. The most common sinus disease can be either one sinuses or all 4. More commonly, what we use navigational sinus surgery for is for either revision sinus surgery, or where the anatomy has been modified, or primary surgery where the anatomy has been obscured, meaning like nasal polyps, where you can't easily see the normal bony architecture. With navigational sinus surgery, we do much finer slices on our CAT scan of the sinuses, which allow us to see more intricately the sinus disease that's present. It also makes the surgery in some ways more safe because we can more clearly see exactly where we are in the nose using the navigational protocol. So here we are in the OR suite, the operating room, and I'm going to demonstrate a little bit about how our navigational sinus surgery works. As you can see here, we have the images that have been scanned into our Medtronic fusion system. And it gives us a 3D approach, both axial, coronal, as well as sagittal systems. So, as you can see, if I move the mouse around, I can look at different things, and I can actually even scroll through the images to see where the sinus disease is. Okay? This red dot kind of tells me where we're at. While we're doing the procedure, we actually put an external patient tracker on the patient's forehead, and we gather some anatomical points on the facial skeleton. Those points get mapped with the CT scan that we have here that allow us during the surgical procedure to use our navigational protocol to actually operate on the sinus film, but it's been mirrored with her facial anatomy. So as I was saying before, we can do very extensive sinus surgery knowing where we are in the nose within approximately 2 millimeters at all times. If you would like to book an appointment with me to discuss your sinus issues, you can book an appointment anytime online by simply visiting our website.